Hey everybody, my name's Lisa Miller. I am the Director of Counseling here at StartBupe. Welcome to fall, y'all. Sorry, I had to get that in. Anyway, today we have something really cool. Dr. Raad, the medical director here at StartBupe, is going to kind of give you some guidance and some tips that you can use to navigate your way through the program with the least amount of bumps in the road as possible. So pay attention, listen to what he's saying, listen with more than just your ears. All these things will really help you while in recovery here at StartBupe. So without further ado, here's Dr. Raad.
Hi friends, Dr. Raad here. I hope you're doing well. To any new patients watching, I'd like to congratulate you all on starting your journey of recovery with us. To current patients, remember to keep working your plan every single day. The road to recovery can be difficult, and it should be. We're fighting a monster, and it's called opioid addiction. That sounds daunting, but realize that you've made it this far, so let's keep going. Today, I'd like to discuss some refill processes with you, whether you're a new patient or not. You know, we must comply with federal and state regulations. You help us do that when you complete your monthly requirements. It's more than a program payment. You submit monthly drug tests, work with our counselors and staff, and meet with providers when necessary. When you do this, it makes the refill process easier for both of us. Minimum requirements to be eligible for your refills are this. Number one, you need to send a toxicology test once every 30 days. Sometimes we do ask you for frequent tests, but we will let you know if that is the case. Secondly, please respond to our outreach as soon as you can, whether it's a phone call, text message, or email. This applies to all of our staff. Thirdly, respond when we request you to follow up with a provider, whether a 6-month medication check with your medical provider or a counselor, contacting you to provide you more support. To make the communication easier, please let us know when your phone number, address, or email changes. Please also set up your voicemail and keep it clear so we can leave you messages. And lastly, sometimes we contact you to verify your current medication supply. When the staff reaches out to you, you must respond within the time frame specified. Typically, this will be 24 or 48 hours. Not responding is the worst response. Now that we've covered the minimum requirements for expected refills, the next is let's talk about bridge refills or unscheduled refills. We're not obligated to bridge your medication beyond what is prescribed. If you run out early or the medication is lost or stolen, the regulations I mentioned previously prevent us from doing this, and the pharmacist on the other end from filling this. And sometimes pharmacies decide to not fill a prescription, no matter the circumstance. So how can we avoid an unexpected refill? The best way to avoid this scenario is to take your medication as prescribed. That way you will always have enough medication during your month. Please keep and store your medication in a safe and secure place that is out of the reach of children and pets. Next, do not carry all your medication on you at once. Keep it at home, and if necessary, buy a locked box to keep it safe. And please, do not keep your medication in your car. Another important item is to keep us informed if you've been prescribed a new medication or being treated by a new doctor, especially if it's a procedure or surgery that might require pain management. During our refill process, we are required to do certain verification steps, and one of these includes making sure no other controlled substances are prescribed to you that we are not aware of. This isn't to say you can't be prescribed medications, but please make us aware of any changes as soon as possible. And lastly, if you have any travel upcoming that might conflict with your refills, please coordinate with our office as soon as possible. So remember, friends, to always feel comfortable to reach out with any questions or concerns. That's why you joined this program, to get help and support during your recovery. And we are here to help. I appreciate you taking time to watch this video. Thank you. Have a good day.